I'm going to provide you with the details on the Supporting Advocacy on Municipal Official Plans project. This presentation is first going to go through some of the background to the project and describe the support that was provided to the member networks of the Healthy Communities Partnership, and then I'll get into the results or the summary of the final report. So this really began with the success that the Waterloo Region Food System Roundtable had in advocating to the region to include food policies in its official plan, which was adopted in 2009. The region is now one of the first municipalities in North America to have food policies written into its official plan. So inspired by this success, the Healthy Communities Partnership submitted a proposal to the Ministry of Health and Long-Term Care for funding to support the partnership or the partner networks of the partnership to advocate for healthy eating, mental health, and active living provisions within the official plans of all the cities and townships within Waterloo Region. The Supporting Advocacy on Municipal Official Plans project included two components, which Judy touched on, and that was the review and identification of municipal policies that support healthy eating, active living, and mental health within official plans, and providing support to the partner networks to advocate to municipal councils. And the goal of this work is that the municipal plans will make provisions that encourage healthy eating, physical activity in every neighborhood, and which create conditions for optimal mental health. There were three member networks of the Healthy Community Partnership. So there's Waterloo Region Active Living, the Emerging Mental Health Network, and the Waterloo Region Food System Roundtable, and I provided support to each of those three groups. So I'll just take you through the work that we did together. So with the Active Living Network, we really focused on how the existing municipal policy and activities at the region and municipal level tied into the development of their physical activity charter. They were planning on taking that charter to the region in the fall. So I did a presentation for them on what are official plans and what are the types of policies that would fit with that, and reviewed the charter to make sure that we had addressed all of the existing policies that they could work with within for that charter. I also provided them with a sample letter to municipal councils that they may choose to take to councils in the future once they've finished the charter and they want to advocate for further work. And for the mental health network, this is really an emerging network, and they weren't quite ready to go to municipal councils yet. So they were more focused on bringing more awareness on how municipal policy can impact mental health. As we know, most of the policies come from the national or provincial level. So the report was really used by that group to gain a better understanding of how the municipal policy could support their work at the community level and identifying gaps in that policy. They were also considering a mental health charter to take to the regional and municipal councils. And the roundtable already had experience reviewing municipal plans and making presentations to city councils. So my support to that group really picked up where they left off. And we reviewed the final plan for the city of Waterloo, met with planners to review those recommendations. I submitted a letter to the city, made a presentation to the city, and then made contact with the various townships to further that work for the roundtable. So the final report, which Judy submitted to everybody, or distributed to everybody, is big, and I'll just go through some of the components of that. So there was the literature review, and then the gap analysis, and the summary and key recommendations, as well as a set of appendices. And the appendices were really to provide some of that background information from where we started. So the current work within Waterloo Region that supported healthy eating and active living and mental health. There was a chart of dates and details for contacting municipal councils to make presentations, an example letter to councils, the sources for the lit review, and then a huge list of all the municipal policies from each of the city and township plans that supported each of the key areas. So I'll take you through the literature review and the summary and key recommendations sections now. So after reviewing a bunch of policies out there, municipal policies or reports and information on official plans and how they can impact public health, I identified 11 key areas that I then took all of the policies and categorized them under. And those areas were walkable access to affordable healthy food, which includes support for a variety of means of accessing healthy affordable food, including markets, food stores, community gardens, all within walking distance of neighborhoods. Urban agriculture, which included all the support for local food production. Sustainable food systems, which included food system policies and sustainable food production policies. Pedestrian linkages, ensuring that there are pedestrian access to all points of interest in the community, including employment areas, stores, recreation areas. Active and passive recreation opportunities. So a variety of opportunities that meet the needs of all users, regardless of age, culture, and ability. Accessible recreation opportunities. Accessibility meaning location, cost, and culturally appropriate. Active transportation, supporting all forms of non-vehicular transportation to move throughout the city. Walkability, supporting the ease, safety, and comfort of walking throughout the city to everyday destinations, including work, shopping, education, and recreation. Affordable housing and safe environments, so support for a range and type of housing that addresses needs for safety, comfort, and livability. Integrated and inclusive communities, support for accessible communities that provide housing, jobs, and recreation for all residents, regardless of age or ability, interspersed throughout the whole city, so non-isolating communities. And the final category was the community connectivity and social cohesion. So support for public gathering spaces and neighborhood design that promotes community connections. So under each of those main categories, there are a number of subcategories, and that's what was used for the gap analysis that you'll see in the report. And all of the official plan policies from the cities and townships were plotted against that chart, or the categories within that chart, to see which ones addressed those categories well, which ones sort of did but could be improved upon, and which ones didn't at all. And we don't have that on the presentation, but you have it in your report. So from there, I developed a set of key recommendations and provided a summary to the group, and we'll go through that now. So overall, we discovered that municipalities in Waterloo Region have included provisions for future development to follow a more compact, mixed-use design that supports pedestrian linkages and alternative or multimodal transportation within and between land use areas. This growth structure aligns with the policies laid out in the regional official plan. Kitchener, Waterloo, and Cambridge are all following the Complete Communities Design Guideline as identified in the ROP. And that is defined as a community that meets people's needs for daily living throughout an entire lifetime by providing convenient access to an appropriate mix of employment, local services, a full range of housing and community infrastructure, including affordable housing, schools, recreation, and open space for their residents. Convenient access to public transportation and options for safe, non-motorized travel is also provided. So that's a new design guideline that has been incorporated into all of the new official plans. Now, the City of Cambridge has also included locally grown food within that definition. Unfortunately, Waterloo and Kitchener have not followed suit yet, but they may change their mind yet. The City of Kitchener included an additional planning guideline. So each of the cities, they adopt their policies from the ROP and then include other policies or design guidelines that they choose. And they have a guideline for healthy communities, and that's described as a healthy community provides access to clean air and water, nutritious food, a variety of employment opportunities, and safe and socially vibrant neighborhoods. A healthy community also promotes active lifestyles by providing access to community and recreation facilities, active modes of transportation, parks, and open space. Kitchener will be planned as a healthy community that provides the basic needs for all of its residents, creates and maintains strong and positive relationships within and outside the community, and offers an overall high quality of life. Planning for a healthy community will create a place where social, cultural, and spiritual differences are welcomed, a place where everyone belongs. Nutritious food was included in this description. However, I had suggested that maybe more explicit wording of healthy local food could be suggested. Now, it's important to know that these design guidelines really direct the whole language for the official plan. So what they say in that design guideline follows right through the entire plan. The City of Waterloo included the additional planning guideline for complete streets, and the regional official plan has addressed this as well as the regional transportation master plan. And that includes facilitating the movement of and interaction between all travel modes, pedestrians, bicycles, transit, and motorized vehicles within and throughout the city. And additionally, the 3 cities are working with the region on the development of an urban greenland strategy, which promotes green roofs and community gardens within urban greenlands. And this is a new strategy that's exciting. Now, each municipality then focuses on specific areas within their plan. So it was really clear that each city kind of picked their topic that they really wanted to address. And the city of Waterloo took a really strong lead and created policies in support of active transportation. Their plan was full of active transportation policies. So a strong preference for pedestrian movement over vehicular movement, a preference for small to mid-sized food stores, and permitting community gardens and temporary farmers markets in all land use areas. The language around community gardens and the temporary farmers markets in all land use areas was really a direct result of the work that the Roundtable did in making presentations to the City Council. The draft plan for the City of Kitchener has outlined policies for more universal accessibility and cultural inclusion and pedestrian-friendly design, so comfort of building location and street access, mixed housing arrangements, including a variety of housing types and styles, and live-work arrangements. That's where they've chosen to focus their plan and their development. And they focused really overall on built form and compact pedestrian-friendly community design and inclusiveness. The City of Cambridge overall had well-rounded policies. They touched on community gardens and temporary farmers markets in all land use areas, supporting the countryside line and protection of agricultural lands, and supporting a diversity of housing styles and affordable housing. But they didn't put a strong emphasis in any one area, not like the Waterloo plan that was really focused on active transportation and blatantly said they prefer bicycles and walking to vehicles in downtown Waterloo. So from that, I developed some key recommendations that each of the partner networks could move forward with the municipal councils if they chose to do so. And the first one was around sustainable food systems. So I had suggested to include stronger policies in support of food system planning and sustainable agricultural practices. It was kind of interesting that the City of Waterloo included the following statement: farming operations are encouraged to utilize sustainable agricultural techniques and best management practices which conserve and enhance the natural environment, protect surface and groundwater quality and quantity, and minimize impacts on adjacent land uses. And the ROP set out a basic description called support the development of an environmentally sustainable and economically viable regional food system. Now, the City of Waterloo, I think, maybe has a couple farms within their jurisdiction. And so for them to include such a strong policy statement was interesting, and that Cambridge or the townships hadn't done that. I think there's room to maybe promote that with them. And the township plans are currently under review, so there would be time to get those changes in. The second recommendation was around urban agriculture. Each of the cities supports community gardens and in all land use areas. However, they have not included a provision for including community gardens in new developments or ensuring that their location is walkable by community residents. So a provision could be created for community gardens. There are different examples, like it could be part of the parkland dedication amount. So right now, within a development, you have to give your 3 to 5% or cash in lieu, but if you were giving the land amount, it can be used for parks or recreational purposes. You could include community gardens within that description. Or you could include another provision that ensures that there is walkable access to the lands that are designated for community gardens. As well, a provision for the protection of community gardens would be helpful, as they're not a temporary land use, and many times they're treated as a temporary land use. The City of Montreal actually provides zoning for a permanent agricultural zone in the city, as well as zoning for new community gardens to be designated as parkland in order to protect them. And another policy area that would help to better support residents in raising their own food would be around the raising of rabbits and hens in residential land use areas. This has been quite a contentious issue within the region. The Cambridge plan actually unintentionally does this by allowing agricultural uses, including community gardens in all land use areas. So raising hens is an agricultural use, so technically it would be allowed. But it doesn't come right out and say it strongly. It would be nice if there were some policies that supported it instead of just coming in under the radar. The next recommendation was around the walkable access to healthy, affordable food. So each of the city plans provides support for farmers markets and community gardens, but the City of Waterloo is the only plan that provides support for small to mid-sized food stores and walkable access to these stores. Within their plan, it says that all residents will have access to a food store within 2 kilometres of their residence. Each of the regional municipalities could include that as well. They could also, each of the municipalities could address the issue of accessing affordable healthy foods better. The ROP states provide a range of human services and income supports that seek to ensure all residents have adequate incomes to be able to afford to buy locally grown and other healthy food products. The next recommendation was around active transportation. The plans could be more explicit in requiring that all residents be within a 5-minute bike ride or 15-minute walk to a pathway or trail to better support active living and pedestrian and cycling networks. Mention is made of being within walking distance of a transit stop. However, no provision is made for distance to trails and pathways. As well, the inclusion of a bicycle parking bylaw would better support destination-based trips by bicycle. And each of the townships could provide policies to support bike lanes on all county roads to link communities. And in terms of walkability, pedestrian linkages are supported throughout the plans and features of creating safe walkable communities. They weren't strongly addressed though. The wording is there, but there isn't a lot of strong policy or wording. So a lot of them said that new designs should follow the crime prevention through environmental design standards, but they haven't really given specific details around comfort and safety and shade and sidewalk accessibility and pedestrian refuge islands and safe road crossings for pedestrians, or I think it was only one plan that had sidewalks on both sides of the street, policies like that. Making sure that there are bus and bike shelters and non-isolating bus stops. And pathways could also be included. So I think that some work could be done in providing a little more detail in these areas. And then the last one was around inclusive communities. So each of the 3 main cities has really moved to adopting the universal physical access design standards. However, the townships have not. And this is an area that could be better addressed to allow access for all individuals within the built-up areas of those communities. As well, something that stood out that I think Peel or Mississauga is starting to do is they are proposing the development of an assessment tool that allows the evaluation of public health impacts of a proposed development or plan, which is kind of an interesting policy to have in place. So right now there's policies in place for a transportation plan being done. So when a new development goes in, you have to show that there's pedestrian and bicycle transportation has been addressed and there's links and stuff. But this kind of a tool, an evaluation tool, would ensure that all of the areas that affect healthy eating and mental health and active living would be addressed in a new development. Beyond the report and the key recommendations and the summary, I also provided some ideas for further advocacy, so that groups, if they wanted to do more beyond going to municipal councils around policy work, here are some things to consider. So getting involved in the zoning bylaw project, especially with the City of Waterloo, they had invited the roundtable to become involved in that, which would help to create the definitions around what are small to mid-sized food stores and what does access to healthy food really mean. So in the bylaws, that's where a lot of the detail of the official plan gets put into place. To get involved in the development of the urban greenland strategy to ensure that those policies and goals are met. Reviewing other policy documents like urban design guidelines, active transportation plan, pedestrian plans, etc., to ensure that the policies support and reflect all aspects of healthy eating, active living, and mental health. Doing a bit of a public awareness campaign, so making people aware of the policies that are in our official plans. What can we do in our cities? How can we be more proactive to make our cities what we want them to be? But because it's new that temporary farmers markets would be allowed in all land use areas, and if people don't know that, they may not choose to start something like that in their neighborhood. As well as doing presentations to community councils on temporary farmers markets and probably other issues too, but that was really an issue that stood out as we were doing the presentations, is that there is a broad range of ideas on what a temporary farmers market is. A lot of people think it's a huge formal market, but it could also be just a stand in somebody's driveway or at the parking lot at the local church or whatever. So just to keep those issues relevant and keep explaining what they are to council would be helpful. Consider bringing forth charters to support various aspects of healthy eating, active living, and mental health, such as the Mental Health Charter or Access to Healthy Local Food Charter, as a couple of examples. And then evaluations. So if there's a way to measure any of the changes that happen as a result of the policy recommendations, or if you do an awareness campaign, that would be good to know. engaging other community stakeholders through the sharing of this report and the municipal policies to help build a broader awareness of the municipal planning process, and getting involved in all planning processes. So there have been a lot of community planning meetings around the Central Transit Corridor and the Creating Great Places Forum. And this is where community input can really take these policies and put them on the ground. And yeah, like I mentioned, continue to speak with municipal councillors and planning staff. There are a lot of people in support of these policies on the councils, and just keep talking with them and helping them to promote the issue and get behind the cause, and they'll go a lot further. So that is what I prepared for the Healthy Communities Partnership, and if anybody has any questions now, I'll be happy to take them.